Hello, everyone. I'm Kristy Bird MaKieve. I'm the CEO of Healthy Rural California. And today I wanted to give a verbal report as I'm planning to write up this summary on the Tribal Medical Education Task Force meeting. Our first one was Tuesday, August 29th, and today's Thursday, August 31st. We covered a lot of really great discussions and information, and so I'm going to try to get through this pretty quickly, both to share in a easy to digest way through a video before I have a chance to be able to write this out. So this meeting was the first of what I hope will be many over the next few years. I do think we have some goals and objectives to meet in the next 6 months. I want to first state that this is not necessarily with the intention at this time of building a tribal medical school in California. It is using those words as a way to coalesce and bring together a lot of thought leaders in the space. But my key takeaway from Tuesday's meeting was that there's actually some really great work in terms of strengthening medical education pathways in California for the tribal nation youth of California. There are 109 tribes, and then there are two major initiatives that have just gotten some footing in the last few years. One is at UC Davis, and that is called the Tribal Prime Program. We at Healthy Rural California are connected to UC Davis for our new psychiatry and family medicine residency programs. Those will be coming online in 2024 and 2025, and they are in partnership with Northern Valley Indian Health. I'm pointing to over my shoulder because Northern Valley Indian Health has a new clinic right next to our office building almost. And they have their Woodland Clinic, which is close to Davis in California and Sacramento. That is part of our family medicine residency. The psychiatry residency is at Woodland, and then the new family medicine residency, which we have submitted an application to ACGME for, is connected to their continuity clinic for family medicine would be half at Northern Valley Indian Health. So we have this really big focus on pathways for tribal medical education. We want to have that as a significant part of our curriculum and didactics. We're still building those out. And so that's how we started this task force as a way of moving the conversation forward. There is no medical school between Sacramento and the middle of Oregon, and that has had a negative impact on health equity for everyone in the rural and underserved region of Northern California. So having UC Davis nearby is a great strength for moving forward. I also wanted to add that Chico State, CSU Chico, is also here in Chico, and I'm pointing in the other direction because they're over there, and they are on Mechoopda tribe land, and they have established some very good tribal programs for their curricula in different ways. So there's also a connection, a very strong connection here in Northern California among all of these entities. FYI, Chico State would like to hire a psychiatrist for their WellCat program in person. I want them to succeed in that so our residents can go there too. And also Northern Valley Indian Health is recruiting a psychiatrist here in Chico, and possibly in Woodland as well, as they build out their behavioral health services in the region. In addition, we were very pleased to have Alec Kalak from UC San Diego. It's Prime Tides, I think, but they too have a new tribal medical education focus. And Alec is also president of a national organization for those who are pursuing medicine and are from a tribe. So, we made mention in our meeting on Tuesday that the UCs are established as land grant institutions. And so the commitment is also to tribal entities. And we were also joined in this meeting. I'm going to try to catch everybody, but Dr. Nevins and Dr. Lynn from Toro University College of Osteopathic Medicine here in California. We're also connected to them at Healthy Rural California. We are looking to have 2 regional campuses by 2025. That would be for year 3 medical students. And one of those campuses would be with Toro and one would be with UC Davis. It's a big lift. Our community is still working toward that, but we hope to have that online by 2025, if not 2026 at the latest. Okay. We also had Robin Simpson and Lupe Alonso Diaz from Physicians for a Healthy California. We had Dr. Ted Zwerdling, who's our DIO for the residency programs, as well as palliative care for Adventist Health. We had Dr. Austin from Northern Valley Indian Health, Dr. Mark Service, Dr. Mark Henderson from UC Davis, and their team, Angel Santillano, Eric Crossan, and Ara Jane Soriano. We had Dr. Jagadisan and Dr. Latran from the VA of Northern California, also one of our partners, and Ernesto Rivera and Horacio Murillo. Both of those are doctors from other parts of Northern California. So it really was a meeting of minds of trying to connect everyone. We are also interested in developing what I call med ed clubs, where we're reaching out to high schools and really starting in kindergarten to encourage and inspire youth in tribal nations to become doctors. Alec really has the greatest story, I think, of all time. He described how his father, from a tribe in Southern California, had wanted to become a doctor in the 1990s, but had to leave California in order to do that, and then came back and is with one of the tribal health centers. And this was an inspiration for Alec. He had a path forward from his own family, but understood that that is not true for many youth. We discussed in this meeting how building out the UC San Diego and the UC Davis programs is super important, but then hiring the faculty who are able to teach and connect with tribal communities is challenging. So we're building the pathway, but also needing to hire the faculty to teach for that, strengthening that pathway. So I wanted to just share that I think my key takeaway was an action item that we can work on here at Healthy Rural California is that we have a new healthcare pathways program, and that we could really start to design that so that we're making sure that we're reaching youth in tribes that may not have access to sort of a medical education club at their schools, and ways that we might be able to help strengthen that pathway in Northern California locally. But the other key takeaway that is above all much more important in moving the conversation forward is to make sure that we're reaching out to the regional chair people from throughout California and talking to them, doing really actually listening, and doing what I would say a listening tour, and because Indian determination and self-governance is paramount. It's above all else. And that would be the best way forward. I'm struggling with my words because my mind always goes to how to, and let's make this happen. And how can we support that? I just have to be honest that Healthy Rural California doesn't have the resources at this time to lead a statewide conversation. And, doing a listening tour is paramount. So I'm kind of putting it out there as, somebody could take the lead in this. It would be fantastic. I do believe Toro University deans were interested in taking a lead in that. So there was also some discussions about meeting with legislators. Some discussions have already begun in different areas, mostly in Southern California. And it was also noted that the UC system and medical schools included are now free to Native Americans. So that's another message that we should be promoting. So engaging the tribal nations, first reaching the regional chair people, and I believe the Native American Physicians Group, though there's several meetings coming up in September, one in San Jose featuring Alec himself, and that's the Physicians for Healthy California Health Equity Summit. And then another step is engaging the dean from Oklahoma State University and the Cherokee Nation. Together, they had formed a new tribal medical school, and that was in 2020. So kind of hearing from them what were best practices. It was shared that 500 applicants per year come from tribal youth interested in pursuing medical school. And really the size and the need here in California is helping to meet the tribal health centers that there are actually many throughout the state. The last time I counted, there's 12 in Northern California, but please don't quote me on that number. I'd have to really look at the list again. But that it is very challenging to recruit physicians, period. But it's also very challenging to recruit physicians who are Native American or have the cultural competency that tribal health center would want to have on their staff. So really the question is, how can we help build that pathway to meet the needs of the tribal health centers? Is it a good lens to look through. There's also that, and I did not take good notes on this, but Medi-Cal referred through a tribal health center have 100% FMAP for services. Alec said it much better than I, and then my notes fizzled out right there. But there's a lot of financial incentives, I think, to focus on expanding care for those who are from a tribe. And then it was noted that any education efforts, K through 16, must be through the tribes themselves as independent nations with their own education leadership. One of the last discussions on Tuesday was that there are 6 new construction for health centers, tribal health centers in the Inland Empire, San Bernardino area. They have new staffing needs. So there's, that pipeline, workforce pipeline. I smile because having worked in Northern California for the past 4 years, but then having been with the California Medical Association and other, and actually I had worked at UC Davis as well. And so I've kind of had my eye on the Southern California resources versus Northern California. And it feels like Northern California is about 5 to 10 years behind Inland Empire efforts. And so I kind of measure our progress in a way based on the progress in the Inland Empire. So to hear about new construction for tribal health centers is very exciting. I don't know if that's a need here in Northern California, but we certainly partner with Northern Valley Indian Health, and they have several different locations and are a wonderful service in town. So that's my summary of Tuesday's meeting, a sense of how we could move forward. I'm excited to explore what could be, and I'm just going to wrap up by saying that we are on a mission to establish more medical education in Chico. And there's also Dr. Danuka in Redding would also like a medical school there. When I talk about a medical school, it doesn't necessarily mean its own standalone school. As I mentioned earlier, we're looking at establishing regional campuses. So it's the year 3 rotations that are for 12 months and having those students here in Chico for the 12 months, 6 different rotations. Again, big lift. But, we're starting with GME, we're stepping into the regional campuses. Ultimately, we might have a branch campus. But again, saying that we're going to build a tribal medical school is more of a simplification so that we can raise awareness, but it's not necessarily that as the outcome alone. So anyway, thank you so much for listening. I hope to write this more coherently and send it out to the task force, and we'll talk soon. Thank you.